Now, while you're here, you can also see white and gray, and thanks. I'll take more if you've got it. There you go. All right, you'll see white and gray here. Yes?
Mm-hmm. Wait.
Everybody's happy with white and gray? What you can also see here is this is the lateral ventricle. Do you see them? The two spaces. What are those spaces living in?
Cerebrospinal.
Okay.
Corpus callosum.
Thank you. The corpus callosum is going to surround the lateral ventricles. Okay. Now, to find the third ventricle, we'd have to cut it slightly differently, and we would end up coming way down here. So we would take off your baby's bottoms, and we'd also take off your cerebellum. I'm going to somewhat do that right now to make a brain stem. Now, hopefully they haven't responded. Whoa. Now, to make a brain stem, not very hard, but the brain stem is vital for your life. What will happen is I'm going to cut off the cerebellum. Okay, again, white and gray. What I'm now going to do is I'm going to take off the cerebrum. And you can see I'm having difficulty with the dura because it doesn't want me to cut it. So I'm going to take off the other hemisphere. Now you get a good shot of your lateral ventricle. Can you see the space?
Mm-hmm.
What's in the space?
Nothing.
There you go. You are seeing a little bit of choroid plexus, this stuff. Okay, what I'm now going to do is I'm going to peel off some structures. Okay. What will happen is I'm peeling off the rest of the hemispheres, but I'm trying to keep the pineal body intact. Got it. Okay, this is your brain stem. The brain stem is going to consist of the cut surface of the thalamus, the two thalami. I'll do this again so you don't have to worry. The two surfaces of the thalami. If the poker is in the middle, that's something known as the massa intermedia. Then we have the pineal body there. We're going to have the superior and the inferior colliculi. Now the other thing we can see is a big space. That was where the cerebellum was sitting. So that's going to be sitting, that space is the fourth ventricle. Can you see the space that I've got? It's kind of like an hourglass shape. Inferiorly, it will lead to the central canal, which is going to be an opening right there. If I go anteriorly, you'll see a flap of tissue. That's where the third, or the aqueduct, cerebral aqueduct will be. But this is the brain stem. Not much to it. Thalamus, superior, inferior colliculi, pineal body. Now, where we had to
pineal body?
Where's the massa?
Massa intermedia would be right in the middle, so it would be right there. So when you look at a sagittal section of the brain, you see the massa intermedia, you actually don't see the thalamus. So, pineal body, superior, inferior, fourth ventricle. Now, on the fourth ventricle, in order to hold on to the cerebellum, you're going to have cerebellar peduncles. Those are columns of tissue designed to support the cerebellum. So if there's a tag over here, all you're going to do is name it the cerebellar peduncle. Okay? You don't have to call it anything else. There's a superior, inferior, and medial or middle cerebellar peduncle, but we don't need to go that far.
So if there's a tag just on the left and right of that?
Right here. Okay, if there's a tag there or a tag there, that's going to be the cerebellar peduncle. On the flip side, right here and right here would be the cerebral peduncles. But the way that you're going to see it is this way.
So it's in the big part, in the...
This thing right here. That's the superior here, inferior, and middle. Those are the columns that support this. That's the brainstem. That's all she wrote.